of some health facilities here in Accra. One of them, controversial body sculptor Dr. Dominic Obeng-Ando, is answering questions for running the Obengfo Hospital without a license from the Health Facilities Regulatory Agency, HeFRA. His facility is among 4 shut down by the HeFRA. The regulator says the move is part of efforts to sanitize Ghana's health system and ensure compliance to standards. We'll have a conversation on this. Dr. Philip Bano is registrar for HeFRA and he's joining me right now. Hello, sir. Thank you for your time. Good afternoon.
Good afternoon.
How do you assess your last operation, which ended up in shutting down for health facilities?
Okay, thanks for the invitation to be on your show. How do I assess our last operation? I think it went well. We were able to effect the arrest of 2 people. A third person is supposed to turn himself in. Then another person that we have to make a special arrangement to pick up. So in effect, I think it went well.
My understanding is that you didn't really have a walk in the park when you got to the Obengfo facility. Do you want to tell us how it went over there and why?
I think there are several videos circulating on social media and some of your sister outlets. I'm trying to avoid trial by media, even because he has a defense. So I'm not trying to malign him or anything, but suffice to say that there was a spirited discussion and engagement when we were at this outfit. But at the end of the day, with the assistance of the police and all the other enforcement officers, he complied. And then he came with us, and then they began the booking process. And I know I engaged with his attorney later on in the day, and then I'll leave it as that. I'll leave it at that.
How does the HeFRA intend to ensure strict compliance to some of these actions that you're taking now? Because we know that some of these facilities end up opening up even after they have been shut. And people, I mean, my colleagues who have covered Obengfo in particular can attest to some of these things happening. And I'm not singling that out. This is just a general question. I was just using that as an example.
Yes, that's quite insightful. And being in the business, I think you have a historical perspective. It's not easy because when we are going after a provider, again, he has defense. There's profession standard, which is what the professional body used. That is the person qualified to do A, B, or C, or X, Y, Z. And that is what Medical and Dental Council, the professional. Now, ours is a new thing, and I'm not aware that there's been a test case. It's called the Facility Law, it's Act 829, where we do not make issues with your ability to, we don't make any references to your professional standard. However, we question whether or not you have a license to operate a facility, which invariably draws in the professional standard issue, because if you don't meet the requirement, they may not issue the clearance to operate a facility. In other words, you may have several qualified doctors in good standing, but there are few that can seek a license to operate, say, a hospital or a clinic or any other medical establishment, if I can leave it like that.
Well, I just want to find out what actually necessitated this move now. I mean, why now?
First, all of them that we went to pick up have been on our radar. And we've been giving all of them at least better than 6 months to be in compliance. So we thought that we're giving them sufficient time, and it's the beginning of the year, so we wanted to make sure that as part of our program of works, we follow through if there are some recalcitrant facilities that simply do not want to comply with the rules. So all of them have been at least 6 months away that what we did on Friday could happen at any time. But for one reason or the other, they have been unable to come forward or to produce documents that would enable us to process them. So that is why we did what we did on Friday.
So since you've been at this, I mean, we've seen now HeFRA taking up this work a bit more seriously, but what is the weakest link that you have identified since you've been at this position? Okay,
thank you again. I've been here by a year and a half now. The difficult or the most difficult challenge we have is resource. Now we have few enforcement officers, but we need more robust legal department, and then we need additional resources because there are about 8 of the regions in the country. We are yet to even establish a footprint there. So we only have offices in 8 of the regions. Nonetheless, we try to comb the entire country so that nothing out of ordinary occurs there. But that has been the greatest challenge, finding the resources, logistics, and also the HR and manpower we need to handle the over 30,000 healthcare facilities that we have in the country.
All right, Doc, I'll say a very big thanks to you, and I'm sure that we'll all be following closely to find out what happens to these 4. And just that doesn't mean that these 4, if they should do the things that are required, which wasn't there, for which reason they were closed down, that they will be reinstated, as in opened up?
Yes, each case will be differently handled based on the facts that are ascertained. And so, yes, there's that chances there. In fact, we look forward to that avenue. It will rather resolve the case than having to press or use all the resources to go to the legal system, which can be quite lengthy. But where there's resistance or someone is unable to comply, then you have no choice but to press further. But hopefully we can resolve all these matters.
Okay, Doc, thank you very much. I was just going to say, if you have any final words that you want to give it to us in like 30 seconds, we'll take it. But if not, those are all my questions for now.
Yes, I would like to use this opportunity to appeal to all proprietors of health facilities out there that go to our website, hefra.gov.gh, and you find the documents that you need. And if your facility is unregistered, you can begin the process now. Please do so before we have to come down hard, because it's no pleasure at all to any one of us. I don't want to see any colleague having to go through what we did on Friday. Thank you.
Thank you very much, Dr. Philip Bano. There, he's the registrar for HeFRA. Well, he says, do what you have to do now before they have to come at you hard. You don't know about the reimposition of restrictions, which is something that the Ghana Medical Association has been calling for. Let's talk a bit more about how it is impacting event organizers, especially. Well, President